Welcome to the CSOHIMSS Lunch and Learn webinar for April. Our webinar today will be the ABCs of Tiger in a virtual learning environment. Our presenters will be Toria from HIMSS and Victoria Wangia-Anderson from University of Cincinnati. Before I turn the presentation over, I do have a few introductory slides that I would like to run through real quick. Before I get started, if you have a question at any time, enter your question into the questions feature of GoToWebinar. If you can't find that, but you can find the chat, enter your question there. At the end, we're going to take the time to answer every question. Handouts are available with the handouts feature of the GoToWebinar app. You should see a little button somewhere that says handouts. You'll see the introductory slide deck, the primary slide deck, a handout on Tiger and VLE, and also the CEU form. All attendees will be all attendees are able to claim CEUs for the CSOHIMSS and CPHIMSS certifications. So let's get started. I would just want to share some information on the CSOHIMSS chapter real quick and on some upcoming events. We've kind of went over this. All the handouts are available in the GoToWebinar application. We will be posting them under events and education, past events. They'll be there in a day or two. We are recording this presentation and it will be available on the CSOHIMSS YouTube channel in 3 or 4 days. If you would like to contact anyone at the CSOHIMSS chapter, our website is csohio.himsschapter.org. We have 2 email addresses, csohio.president@himsschapter.org and csohio.info. The csohio.president email goes to me. My name is Scott Mash. I'm serving as the president of the CSOHIMSS chapter this year. And the csohio.info goes to pretty much all the board members. Somebody will answer your question if you email either of those. We do try to be pretty active on social media. We share a lot of information about upcoming events, these lunch and learn webinars, and different articles and whatnot that we find interesting and that may be of use to our members. If you just look up CSOHIMSS on Facebook, Twitter, and LinkedIn, you'll be able to find us. Please follow us on Facebook and connect with us on Twitter. We use those sites a lot to share event information and just some, various information about our sponsors and just some great articles. So please take the time to click follow. We do want to take the time to thank our sponsors because without our sponsors, we could not provide our members with these educational and professional development opportunities. We are relying upon our sponsors in the donations that they provide. A special thanks goes to our premier level sponsors. Cover My Meds here in Columbus. You can check them out at covermymeds.com. Expedient, they're also located here in Columbus. Check them out at www.expedient.com. Ahead, check them out at thinkahead.com. One of our newest sponsors is Malwarebytes. We also want to thank our elite level sponsors, Metasource, Blue Orange Compliance, Tech Systems, Obix Perinatal Systems, Data Gravity, Leidos, and Time Warner Cable. And we have a few partner level sponsors we'd like to thank as well. Encore MMY Consulting, Virtual Officeware, Direct Consulting Associates, CBTS, and Revolution Technologies. And our advocacy sponsors are OHIMA, Battelle, the Institute for Health Innovation, the Health Collaborative, and Clinisync. We do have a number of events coming up this spring. It's a very busy time for the chapter. And, if you're interested in these events, we try to keep our prices down so we can make our events affordable. Please sign up for these events. We've got some great educational opportunities coming up. Tomorrow, we have a CAHIMSS prep course and exam. There is still time to register. You can sign up right now for the prep course. You can sign up tomorrow morning, at the event for the prep course and the exam. So if you were just dragging your feet, didn't get signed up in time, you can still take the CAHIMSS prep course and exam tomorrow. On Friday, we've got the CPHIMSS exam. Same thing, sign up now online, or you can sign up at the event. The CAHIMSS and CPHIMSS prep course and exam will take place at the Cover My Meds office located at 2 Miranova Place. I want to thank Cover My Meds for serving as host and sponsor for the CAHIMSS and CPHIMSS prep course and exam. Another event we have coming up here in just a couple weeks is the 9th Annual Ohio Healthcare Information Technology Day. Call it OHIT Day. In the past, we've called this Advocacy Day. This event will be at the Ohio State House in the atrium. The theme of this event will focus on the opioid addiction problem and some of the technology that's available now and in some cases required to battle that opioid problem. This is a free event. We partner with OHIMA and Northern Ohio HIMSS to put this event together. And what we do around this event is we kind of educate the attendees on this specific topic. Again, this will be on the opioid addiction problem and the OR system that can be utilized to the technology that can be used to battle this problem and identify potential drug-seeking patients. We also will train attendees on how to speak with their legislators. Then we've scheduled meetings with the attendees' particular legislator for their district. We provide some lead behinds. We kind of train you on how to talk to your legislature to educate them on this problem and on what we believe would be one solution. There was some money set aside for the integration of the OR system directly with the EHR, your practice EHR, your hospital EHR, but we don't believe there was enough funds set aside to make this available to the entire state. So really our ask is going to be to increase the funding around this technology. Great event, free to attend. Please consider signing up. In May, we have our spring conference. Our spring conference is going to focus on cybersecurity and HIPAA privacy and security. We're calling this event the Hacker's Guide to Hacking Healthcare, the conference on privacy and cybersecurity that you just can't miss. This event will take place at the OCLC Conference Center in Dublin on Friday, May 20th. This is going to be a great event. We have more speakers, more breakouts than we've ever had before. We're featuring a vendor showcase where our premier level sponsors will be able to present on a product or a service in addition to our core educational agenda. Check this event out. If you work in HIM or IT or really anywhere in healthcare, you're going to get a lot from this event. It's a great setting, great speakers, priced very reasonably. Check it out and sign up. Links available here. We do have some future Lunch and Learn webinars I'd like to share a little info on. Next month, May 11th, our speaker Lisa Cannon will be presenting on developing your brand and recruiting considerations and everything else for, as you transition into an HIT role. Now, this presentation is going to be great for students that are coming out of college. It's going to be great for those that are considering a career change. Even if you're in HIT and you're thinking about moving to a different role, Lisa's going to provide some advice. Lisa works for a group that focuses on recruiting. She knows what these organizations are looking for. She knows what recruiters are looking for, and she's going to share some of that information with us. Consider signing up. Again, our webinars are all free, and you get CEUs. In June, we're going to kind of piggyback on our security theme from our spring conference, and we will have Patrick Quirk presenting on best practices for avoiding and mitigating breaches. Patrick works for Focus Partners. They are a security organization. Going to be a great presentation. In July, We are going to have a presentation titled Enabling Actionable Real-Time Data Through Cloud Analytics as a Service. Joanne White, who's the CIO of Wood County Hospital and also serves on the CSOHIMSS board, will be partnering with one of her employees to provide that presentation. Then we have some open dates. We've got a few folks who have submitted proposals, so we should have a few dates plugged in further out this year. But by all means, if you have a story you'd like to tell, you have some expertise you'd like to share, or if you want some presentation experience, by all means, contact me. We want to make this a monthly event going forward. It's a great way to get presentation experience, and also you will receive points towards membership advancement. So you can, if you're working towards becoming a senior member of HIMSS or a HIMSS fellow, these presentations count towards that membership advancement. We do have a couple other groups that we work closely with. One of those is OHIMA. We actually partner with OHIMA on OHIT Day, so we are going to share information on OHIMA's annual meeting and trade show. This is March 7th through 9th at the Hilton Columbus at Easton. This is a great event. I try to attend every year. I've actually presented at this event. Great event for anybody who is a member of HIM, or if you're in an IT area that supports HIM, by all means you should plan on going to this conference. And now I would like to turn it over to our speaker. Victoria, are you there?
Yes, I am.
I do not see Toria on the line yet.
Oh, not yet.
Have you heard from her today?
I know she had a webinar right before this one, and we were on that together, but I was assuming she would join immediately after that. So let me just check email real quick to see if she's on.
Okay.
If she sent us anything.
Hey guys, I apologize. Our one of our speakers hasn't got on today, and we've been kind of talking back and forth and hoping all is well with her. We're going to check real quick.
Yeah, okay.
So just hang with us for a few minutes. Again, if you do have questions as we go through, enter your questions into the question box. If you can't find the question box, you can go ahead and use the chat box. I do apologize for the delay. Go ahead and get the other presentation pulled up.
I don't see an email from her. Can I quickly try to call her?
Yes, ma'am. I'm going to go ahead and put you on mute. Attendees, please hang with us, and I do apologize for the delay. While we're waiting, I will see if I can find the agenda for our upcoming events. So I can give you a little more detail, maybe share some information about our speakers. I am going to pull up the spring conference agenda first. Try to shrink a few things down here. Okay, I've got our spring conference agenda up. Again, this conference will focus on security. Toria, how are you doing? Toria, can you hear me? Our speaker has joined us, folks, so please hang with us. Toria, say hello.
Hello, everyone. Can you hear me?
Yes, ma'am.
I apologize. I think my Outlook has it wrong. It's showing noon Central Time for me. So
Oh, I'm sorry.
my sincere apologies. I was practicing, so I am happy to be with all of you.
Well, the floor is yours. I ran through the introductory slide deck, and then I started stalling and ad-libbing. So the floor is yours.
Wonderful. And I believe that Victoria Wangia-Anderson is actually going to kick off the event. Victoria, are you there?
Yes, I am. Good to hear you. So Toria and I will be presenting, and as she mentioned, I'll kick us off, and then I'll turn it over to her to talk about the VLE, which is really the meat of this presentation. Next slide, please.
Oh, sorry. There we go.
I'll just start with a quick introduction of myself. I'm a program director at the University of Cincinnati for the Master of Health Informatics program, and I'm also faculty. And I'm a volunteer on the TIGER committee, which is a committee affiliated with HIMSS National. I've worked on certain ONC projects specific to privacy and security and consumer engagement and health information technology. And my background in informatics.
I'm going to print this document off for. Can you go get it?
Public health and population health informatics. Next slide, please. In today's presentation, we hope you'll be able to learn about the TIGER initiative and the virtual learning environment, which we call the VLE, that's the acronym. And we're hoping you'll see an in-depth demonstration of this educational portal and learn about the newest VLE offerings, how to navigate with ease, and how to maximize time spent leveraging resources, as well as discover the benefits of being a TIGER VLE pilot partner, and also hear about some the newly migrated TIGER website. And Toria, again, will be talking about the VLE. Next slide, please. So I'm sure you're wondering what TIGER stands for and what it is. TIGER stands for the Technology Informatics Guiding Education Reform. And TIGER is really a grassroots program focused on educating, specifically education reform and fostering interprofessional community development. And it started as a nursing entity and has expanded to interprofessional, so we're excited about that. The spirit of TIGER is to contribute to a learning health system that really maximizes integration of technology and informatics into seamless practice, education, and research resource development. And TIGER began as a grassroots initiative in 2006 with support from over 70 contributing organizations, including HIMSS. And it was supported by 2 grants from the Robert Wood Johnson Foundation and also a personal endowment. And TIGER is dedicated to advancing the integration of health informatics, again, to really transform education and practice. And 10 years later, many volunteers have contributed towards the mission of TIGER and have really helped advance the TIGER cause. And with a focus on better preparing the clinical workforce to really use technology and informatics to improve the delivery of patient care, TIGER transitioned to HIMSS in 2014 and now falls under clinical informatics. Next slide, please. And really, when this transition happened, HIMSS expanded clinical informatics activities to include these activities listed here. So reforming clinical education curriculum through the integration of IT, information literacy, informatics, and the infusion of technologies for learning in a robust virtual learning environment. And then it also expanded to include developing and implementing learning innovations, fostering faculty development, and ensuring universities and providers have the necessary health IT education infrastructure, as well as identifying, modeling, and implementing collaborative partnerships among public and private academic enterprises to launch a student and intern informatics scholar program. And then also one additional activity was really increasing faculty and student acceptance and understanding of health IT through education and training, incentives, and necessary support. And being in academics, this really resonates to me, and that's part of why I'm really excited to be contributing to TIGER. And this was my first year with the TIGER committee. Next slide, please. And this is just a visual of the Tiger community structure. The communities really bring together colleagues to really connect and learn and lead our national initiatives. And the communities offer peer-to-peer networking, problem solving, subject matter experts, education, solution sharing. There is an interprofessional steering committee which includes former Tiger Board of Director members. And in the next few slides I'll elaborate on what the Tiger Committee is and the Tiger International Subcommittee. They're also part of this image that you see here. Next slide, please. So the Tiger community is led by this Tiger committee, which is really charged to provide domain expertise, leadership and guidance to activities, initiatives, and collaborations within the interprofessional community. And our co-chairs this year have been Dr. Marian Ball and Dr. Trosich. And we do have committee members, 8 volunteer committee members and staff, 2 staff liaisons. Next slide, please. And the Tiger Committee comes to consensus on annual goals to focus on. So our goals for 2015 to 2016 were really to provide clarity for the Tiger community and really reduce duplication by identifying and sharing a common set of definitions for e-health and informatics while honoring discipline-specific definitions. So the committee has been very active in trying to come to a consensus around definitions that we can provide as resources in the virtual learning environment. And the committee also had a goal to support the development of Tiger at the regional and grassroots levels, and really by providing a suite of resources to those interested at the chapter and organizational level. And this goal really prompted the communication we had with CSOHIMSS and Scott Mash. And we appreciate that Scott Mash was willing to be the first to agree to work with us on this goal. CSOHIMSS is now our model site for this as we move forward, and the plan is really to continue contacting regional HIMSS chapters and to provide the interested chapters with information about Tiger and about the resources that Tiger has, such as the virtual learning environment that Toria will be talking about. And we're also very interested in presenting at forums like this and always interested in new stakeholders and really fostering that interdisciplinary approach to health IT. And we do have a booth at the national conference and encourage you to stop by if you're able to attend that national meeting. And then one additional objective that the committee had this year was really to provide subject matter expertise guidance in the successful execution of the Tiger virtual learning environment, which is the web-based learning platform Toria will be talking about, and that really incorporates health information technology into interprofessional education for faculty, students, and clinicians. And then I'll conclude just talking about the Tiger International Subcommittee. Next slide, please. And this was established in 2012. 19 countries are represented with 29 members and liaisons, and the countries are listed here. And they're also on the website, the Tiger website. Next slide, please. So I just wanted to highlight what I think is a groundbreaking project that the Tiger International Subcommittee has been working on, and it's the Tiger International Subcommittee has completed a first round of an innovative competency synthesis project that really highlights recommended core international informatics competencies. And in 2015, the Tiger International Subcommittee, with representatives from 21 countries, actually began comprehensive activities to really compile recommended core international informatics competencies reflective of many countries, scientific societies, research projects, and the endeavor really comprised of 3 components. So they did compile international case studies and submitted those. They were submitted by committee members from Finland, Germany, and that was inclusive of Austria and Switzerland, Ireland, New Zealand, Philippines, and Portugal. And this really reflected specific country competencies based on country requirements, curriculum, and education. They also deployed a survey last fall in November, and this was really to evaluate and prioritize a broad list of core competencies. And based on the results, Tiger will identify core informatics competencies of healthcare professionals in 5 domains. So they'll be focusing on nursing management, IT management and nursing, quality management, and interprofessional coordination of care, as well as clinical nursing. And lastly, they do have plans to create a competency harmonization matrix, and this matrix will outline shared and country-specific competencies to provide guidance to the Tiger community. So I'll now turn this over to Toria to talk to you about the VLE, and I thank you so much for your attention and this opportunity.
All right, Toria, I have unmuted you. Do you need me to make you the presenter?
If you could advance these slides, and then once we go into share screen, it would be great if you could pass me the ball, or you could pass me the ball now.
That's okay. I can go ahead and advance now.
Okay. So the next slide. Thank you so much. So good afternoon, everyone. Thank you so much for making time to join us today. My name is Toria Shaw. Everyone calls me Tori. And I am the manager of clinical informatics at HIMSS North America. I am based in the Chicago office. And as Victoria was sharing, Tiger transitioned from a standalone foundation to HIMSS on September 22nd, 2014 underneath clinical informatics. And that perfectly aligned with me coming on board with him. So I've been in this role for about 1.5 years. As manager of clinical informatics, I'm really focused on managing the day-to-day activities for Tiger and our virtual learning environment, which we affectionately call the VLE. So in my role, I'm focused on education reform initiatives, fostering international community development, preparing the clinical workforce in universities using Tiger curriculum, while continuously evolving the VLE in collaboration with several HIMSS teams and our incredible Tiger global volunteers. Next slide, please. All right, so what exactly is the virtual learning environment? Powered by HIMSS, really quick, this is what our lobby looks like, and I'll be giving you a detailed demonstration shortly. You can actually advance the slide, Scott. So powered by HIMSS, the VLE is really a unique and dynamic education resource for academic professionals, students, adult learners, and clinical educators. It contains resources that are reflective of core international competencies that is really designed to take the user from A to Z in health IT. It's a personalized learning experience ultimately designed to expand your informatics skill set and knowledge on important health IT subjects. So you're going to notice that resources and materials within the VLE, all of them can be viewed within the VLE, but some of them can also be downloaded so you can take them on the go. And the VLE is really great because it's available online. So as long as you're connected to the internet, you can access this education portal 24 hours a day, 7 days a week. And this is really vital because when we did some surveying, we found that most of our users, our Tiger community, you're either working full-time, going to school, and then some of you are a hybrid of both. You're working while going to school. So we know that you need to have resources that are able to meet you where you're at on your time schedule. I will also share that the VLE really highlights the work of open source collaborators. So you're going to see curriculum on there from the Office of the National Coordinator, the ONC. We are interprofessional and interdisciplinary now. We've shifted our focus from that grassroots nursing focus to, so you'll also see pharmacy curriculum that has been developed by Partners in E. You're going to see quality and safety education for nurses, QSIN curriculum, and then you're going to see some courses developed by HIMSS, amongst others. You can advance the slide, Scott. Thank you. So before I go into the demonstration, I just want to give you some history about the VLE. It was originally launched in 2009, and when I came into this role in the fall of 2014, one of the first projects I was charged with was, doing a complete overhaul of the site, renovating it in order to be able to reimagine it. So in February 2015, the VLE was relaunched. So if you know about the VLE previously, you'll see that today there's an updated look. We've made the navigation super easy. You're going to see updated curriculum. All right, so Scott, do you want to pass me the ball so I can share my desktop?
Yes, ma'am. I will make you the presenter. Should be able to click a show my screen button.
Okay, great. Do you see the VLE lobby?
Yes, ma'am.
Wonderful. All right, so I'm also going to share that the VLE is subscription-based. So how it works is you purchase an annual subscription for $40, and then you have unlimited access to the environment for 1 year, along with the VLE webinar series and archive, which I'm definitely going to dive into and share more about during today's demonstration. And so, okay, this is the main lobby of the VLE. When you come in, you notice these 4 big navigation buttons. So that's where we're going to start today. We're going to start with getting started. When you click on getting started, you're going to be our user guide pops up, and this is really great because the user guide is going to provide a complete overview of the VLE. It's going to teach you the ins and outs of navigation. It's literally going to walk you through, how to set up a user profile, how to maximize your time spent within the VLE. So I always point this out as one of the key things. Download the user guide. It's really going to help you maximize your time spent in the environment. The second tab is our events tab, and this is where the events theater will launch once you click that button, and this houses our archived as well as our upcoming webinar events. So on this left-hand tab, you're going to see these are upcoming events. If you click that add reminder, it'll add an Outlook reminder so that you're notified when we have upcoming events come up. So if you go into the VLE, if you purchase a subscription or you already have a subscription, I strongly recommend that you peruse these upcoming events and then save any reminders that may pique your interest. And we also have an on events tab. These are all of our webinars that previously took place. So our webinars are recorded live, but then they are archived again to provide you to be able to watch them on demand when you have time in your schedule if you miss the live event. And the goal with all of our webinars is really to showcase leaders in the health IT informatics field. So you get to know some of those leaders, but also to address any hot topics or emerging trends that are going on. I also want to let all of you know that we do offer 30-day free trial access to the VLE, so if after today's demonstration you're curious but you're not ready to make that $40 a year investment, I'll share some contact information and you can send us an email and we will get you set up with 30-day trial access. All right, I'm going to go back out to the main lobby, and now I'm going to go into our resource library, and obviously this is where most of our resources are currently stored. So the resource library is organized based on user needs and level, with the exception of our 2 HIMSS courses tied to certificates of completion, which I'll share in just a moment. But all of the folders in the library are organized to increase your health IT knowledge. So you're going to notice as you progress throughout the library that concepts and ideas will expand upon each other as you progress and move around. So let's start with our basic health IT competencies folder. So all of the resources in this folder are really appropriate for those who are new to the health IT field. They could be an entry-level health IT specialist, they could be a student or an adult learner who might be switching fields. all of these resources are really designed to provide those basic gap level training needs to help you become better acquainted with core concepts around the application of health IT and care delivery. A couple of things I just want to call out here. You'll notice by a resource there's a little drop-down arrow. This is going to provide you with a description of that resource. People can also rate resources and add comments, and we strongly encourage you to do that. We take all of the feedback very seriously, and we're continuously selecting new resources for the VLE, so we definitely take all of the comments into consideration when making those decisions. All right, in every folder there's a Getting Started folder, and this PDF is really basically an overview. It walks you through, you know, where to begin, where to end. So again, this document is really designed to help you understand the flow and the information as it's stored in the folder, and again to maximize your time spent within the environment. All right, our next folder is our information literacy folder. There's only a couple of resources in here currently because the bulk of the resources for this are associated with a HIMSS course, which I'll talk about in just a moment. But the information literacy resources are really appropriate for those who are more intermediate level. So they're learners who are already experienced with interacting with health IT. They're already integrating it into their workflow. We have an information management folder. This is for those who are more advanced level audiences, so interprofessionals who are in senior level health IT roles that are shaping IT strategy, selection, and implementation for their organizations. I do want to say this though, even though we've designed these folders based on skill set and where you're at in your career, I would strongly encourage you to explore all folders regardless of where you're at or your skill set, because I think that even if you're an advanced level learner, you're going to find a wealth of information and resources in the basic health IT competencies folder and the information literacy folder. So by no means should you just go to your target audience folder, explore all of it. And that brings me to the fourth folder, which is the VLE resource index. And this index is just as important as that user guide because, let me pull it up, the resource index really outlines every item that's currently uploaded to the VLE. It also contains a short description that contains key searchable words. I always use this as a starting place for getting into the VLE because it helps you, see all of the offerings by folder, those descriptions, so you can kind of strategize, okay, this is where my need is, this is where I want to evolve my skill set, and then you can plan accordingly how you want to navigate the VLE. All right, and then our very last folder is our webinar CSOHIMSS credit form. So for qualifying professionals, we do offer 1 hour of enduring credit for our webinar series. All right. So again, just to recap, I think so far some tips to share is definitely download the VLE resource index and then download the user guide, because again, that's going to really teach you the nuts and bolts, the ins and outs of VLE navigation. All right, so we have a top navigation toolbar. And the idea was to order this in relevance of user needs. So you're going to see this is the home button. It'll just take you wherever you are in the VLE. It'll take you back to this the home page. This is another way to access the user guide. And that's actually a pop-up. And then this is the second way to access the resource library. And this drop-down menu is really important because I just spoke about those 2 HIMSS courses that are connected to certificates of completion. And I'm going to go right into those right now. So this is our Health Information Technology Foundations course. It contains 9 curricular units. This course is a HIMSS course, and it really offers an overview of healthcare, health information technology, health information management systems. The focus is on the role and the responsibilities of entry-level health IT specialists in each phase of the health information management systems life cycle. I also want to call out that the curriculum is aligned to the new Certified Associate in Healthcare Information and Management Systems, the CSOHIMSS certification that is administered by HIMSS. So if you're studying for that, this would be a great course for you to dive into and get familiar with all of that information. That will certainly, most of it will be reflected on your the test that you sit to become certified. So again, this is an entry-level course. And then we also have an intermediate level course. It's called Information Technology in Healthcare. It's, again, for those who are experienced interprofessionals who are already interacting with health IT, already integrating it into your workflow. So how this works is certificates are awarded once all course modules have been accomplished for each course. At the end of that, so you'll see that this information technology and healthcare course, there's 16 modules. So once you finish moving through the 16th module, you're going to be able to sit for a final assessment. You need to pass that final assessment, which really tests all of the information covered throughout the course. You need to pass it with a score of at least 80%. If you are successful, you'll be prompted to print your receipt actually on demand. So your certificate is going to be stored in the communication center, which I'll talk a little bit about more later on. But this is a really great offering. We created this offering because we really wanted subscribers to be able to have a way to demonstrate and promote their expanded health IT knowledge. So whether you're a student looking for an internship or graduating and looking for a position in the field, or you're looking for a promotion, we strongly encourage you to go for these 2 certificates of completion, and then you can actually post them on your CV or resume. People have also posted them on their LinkedIn profile. So again, we really hope that these certificates will aid you in demonstrating your expanded health IT knowledge. All right, one other thing I want to call out on this drop-down menu is the briefcase. And at the beginning, when I first started the demonstration, I shared that some of these resources can also be downloaded and taken on the go. So this briefcase, say you like, or you don't have a lot of time, but you want to further peruse a resource and you want to store it, you can actually save it to your briefcase and then streamline your time by coming in and going directly to your briefcase. You're going to see there's a little download button, and this is great because you can manually download some of the selected documents, or you could download all documents at the same time. But I think this is a really great feature because I know that sometimes we don't have time to, actually physically be reading all of the information within the VLE, but it's great to have the option of taking those resources on the go. All right, again, this is the second way to access our on-demand theater. And then next, we have a message board. This is really important because we want to share information with our community. We also strongly encourage you to interact with other VLE subscribers. This really is a Tiger community. So we try to post information about upcoming events, Tiger-related topics. We also encourage our subscribers to post about emerging trends, hot topics. You can ask a question here. You'll also see that this little drop-down takes you to my profile. And I spoke about this earlier. This is where you can really customize and update your personal information. You can change your login password here. And I encourage you to keep your profile updated because there are a couple of different ways to communicate within the VLE, which I'll talk about a little bit later on. Another great thing about this drop-down menu is the option of seeing who's here. So This enables you to see other subscribers that are currently logged in. You can chat with them. I'll talk about that a little bit more. But this gives you an idea if you want to do any networking while you're in the VLE. All right. This fourth button right here, I want to discuss further because it's a really important one. This is our help desk. So there's 3 tabs here when you come in. The first one is the help desk message board. This is important because say you're having issues or questions about the VLE, any kind of technical logical issues that you can't solve on your own or with the help of your help desk, you could you could post here, and we're pretty speedy about getting back to you. Other people, a lot of times people will need a receipt for their subscription purchase. So you'll see it's a really great feature. We get the email in real time letting us know that someone has posted to the help desk, and then we try to get back to you as soon as possible. I will share that obviously the help desk is manned by the Chicago office, and we are present from 9 to 5 Monday through Friday Central Standard Time. This second tab is really important because it shares computer tips. It provides you with helpful information on minimum computer requirements and how to use a mobile device or a tablet to navigate the VLE. And then the third and final tab is our FAQ tab. I always suggest that people start on this tab when you come into the help desk because any issues that you are experiencing, I'm almost sure that they're going to be covered on this FAQ tab. If the tab doesn't help you resolve things, again, please post on the message board, or you can contact staff directly via email, and I'll show you how to do that in just a moment. All right. So the last thing that I'm going to cover in today's demonstration, really quick, this little tiger logo, if you click on this, it will actually take you to our HIMSS landing pages on HIMSS.org. You can find us at HIMSS.org/tiger, and I'll talk a little bit about that in just a moment. But then these 4 icons down at the bottom. This is the third way to access the home page, and then I spoke about this earlier, this is the Communication Center. So this is where you could send messages to other VLE subscribers, you could initiate a chat with someone, and then you can also share your business card here, and this is great because the information that you post on your user profile is reflected on your business card, and that's why I strongly encourage you to keep that information updated in case you want to share your V-card, virtual business card information with other VLE subscribers. All right, and then finally, if you need to send us an email, if you click on that little I help icon, it will populate an email that comes directly to us. All right, and then one last thing before we conclude is you'll see down in the lower left-hand corner, this is information on if you want to become a tiger, and I'll talk a little bit about that in just a moment, but this, if you click here, it will also take you to the tiger landing pages on HIMSS.org. And then exit is how you leave the VLE. And Scott, at this time you can stop sharing my desktop, and then I'll conclude with the slides before we open up to questions.
All right, let me see what I got to do here to make myself the presenter. All right, let me see if we have any questions at this time.
I think there's 2 more slides. I'm sorry. Could you advance that
there
slide?
we go.
Okay, earlier we talked about, discover the benefits of a VLE bulk purchase subscriptions. If you have staff or students that you would like to provide access to the VLE to, we do offer discount on subscription purchases of 10 or more. I'm always happy to do customized VLE demos for any of your staff or students. And if you were to purchase bulk subscriptions bundled in 10 or more, I send out valuable tips and techniques for navigating the VLE. And then we always invite our bulk purchase subscribers to share their story of how they're leveraging Tiger VLE curriculum for their target audience. And we do this through the Tiger VLE webinar series and then HIMSS international publications. We have a Clinical Informatics Insights journal, and we also have an online Journal of Nursing Informatics newsletter. So if you're interested about this, if you want to know more information, go to himss.org/tiger. And you can advance this slide, Scott. All right. Previously, Tiger had a standalone website, but we have migrated to himss.org. So in December, we are officially under himss.org/tiger. And when you come here, you're going to be able to find so many dynamic resources about Tiger. There's a Tiger landing page. There's a VLE button that gives you a complete overview of the VLE. There's also a 30-minute demonstration, so if you want to see this again, there's a recording on that landing page. It also talks about our webinar series and archive. It talks about the certificates of completion. Then we also have a marketing toolkit. And so you can utilize marketing tools to help us promote Tiger. It includes a Tiger elevator pitch, flyers, slides, logos, banners, templates. So help us spread the good Tiger news to your colleagues and communities. And then finally, there's a Tiger Initiative reports. If you are in need of any specific topics about education reform or interprofessional community development, this is the starting place for you. There are some resources on the topics of consumer empowerment, competencies, education and faculty development, national health IT agenda, standards and interoperability, along with the VLE. And so I strongly encourage you to peruse these landing pages on himss.org. Next slide. And perhaps after hearing Victoria share about Tiger's history and transition to HIMSS, and then me sharing about the VLE, maybe you want to get involved. HIMSS does have an annual call for committee volunteers, and this year's did close, but you can look for another announcement of that opportunity in the spring of 2017. In the meantime, we would love to have you join us for one of our VLE webinars. Also, if you have a topic or a speaker that you've heard and you'd like to make a suggestion for us to have them speak within the VLE, please reach out to us and share those topics and speaker ideas. If your idea, including yourself, if your idea or speaker is selected, we will invite you to moderate the session. There's also a himss.org blog. We post Tiger blog entries quarterly, so there are some of those posted on the himss.org blog. And then lastly, I want to strongly encourage you to sign up to the Tiger listserv, and you can do this by emailing tiger@list.himss.org. And by doing this, you become a Tiger, because Tiger's a little different. HIMSS membership at this time is not required for you to get involved in the Tiger community. But by signing up to the listserv, you will also receive our bi-weekly newsletter every 2 weeks in your inbox, and that newsletter is really focused again on sharing Tiger-focused news, events. We talk a lot about upcoming webinar series, global Tiger events, and I also always share a ton of VLE navigation tips, techniques, and talk about our newest resource offerings. So those are just a couple of different ways to get involved. You can email tiger@himss.org with any questions that you have. Next slide. Okay, yep, perfect. So thank you all, and at this time I know we only have a couple of minutes left, so I want to get to any questions that may have come in. Scott?
No questions have came in, so.
Well, that's great. If you have any questions after our Lunch and Learn concludes today, You can contact me via email. Victoria Wangia-Anderson's email is also there. Again, you can find Tiger at www.hims.org/tiger. You can also email Tiger directly at tiger@hims.org. We are on Twitter. We have a very active Twitter page, so About Tiger, and then is our handle, and then our hashtags would be Tiger Sightings or Tiger VLE. So thank you so much, Scott, for this wonderful opportunity. And Victoria, do you have any closing remarks?
Again, thank you so much for the opportunity, Scott. And I thought this was a really good complement to the offerings tomorrow and on Friday. Toria, you missed that, but Scott had announced that there are some review courses for certification, the HIMSS certification courses.
Yeah, we're hosting the CAHIMSS and CPHIMSS prep course and exam here in Columbus. On Thursday, we're doing the CAHIMSS, and on Friday, the CPHIMSS.
Fantastic.
Well, Toria and Victoria, I appreciate you guys taking the time to present to us today. Thank you so much. It's a great benefit to our members and to all the attendees to learn about Tiger and you know, some of the other offerings of HIMSS that maybe we don't hear so much about as we do kind of the you know, the core HIMSS conference and whatnot. So this has been a great presentation, and thank you so much. And to our attendees, handouts will be, again, they're available in the GoToWebinar app. If you weren't able to find them or whatever, we're going to post these up to the CSOHIMSS website here in the next couple days, and we'll also be posting a recording of this webinar to the CSOHIMSS YouTube page. So with that, thank you all for attending, and we'll go ahead and end.